morning, this is Channel 4 News. I'm Samantha Jones, and today's top story is the introduction of insulin as a new treatment for Alzheimer's. Insulin signaling in the brain is lost during synapse degradation characterized by Alzheimer's, and new research suggests that patients may be helped by a novel treatment with intranasal insulin spray. In studies of human and mice models of Alzheimer's, insulin was shown to improve cognitive function. Alzheimer's is the #1 neurodegenerative disease worldwide. Currently, there are no cures or effective treatment for Alzheimer's. Symptoms of Alzheimer's include severe loss of memory and dementia. More than 5 million Americans have been diagnosed with Alzheimer's today. It is also the 6th leading cause of death in the United States. Last year, Alzheimer's cost the United States approximately $203 billion. People with diabetes mellitus are at greater risk for developing Alzheimer's and may have increased mortality rates. Mice models with type 2 diabetes, induction of Alzheimer's disease sped up the process of synapse degradation and memory loss. Now we are going to talk to Dr. Ford regarding her views on this new insulin treatment.
While the risk of death from many diseases such as influenza or polio that plagued past generations continues to fall dramatically, the prevalence of Alzheimer's disease is actually rising. Many people know that the disease affects mainly the elderly, and many people know that there will soon be more elderly people in the country than young people, but not many people are talking about the enormous financial burden this disease has and will continue to have as its prevalence rises. That's why it's so important for us to learn the mechanisms of how Alzheimer's disease works and how to identify and treat it. We know of several factors that increase the likelihood of Alzheimer's disease occurrence later in life. One of the most interesting is the link between diabetes and insulin resistance and increased Alzheimer's disease occurrence. Alzheimer's disease is characterized by abnormal beta-amyloid plaque deposits and tangled tau protein fibers in the brain. High levels of beta-amyloid peptides have a synaptotoxic effect, meaning that it impairs communication between neurons. Insulin can help to modulate the levels of beta-amyloid peptide in the brain. In patients with diabetes, brain sensitivity to glucose is impaired, and this glucose dysregulation is linked to reduced levels of insulin and insulin activity in the central nervous system. Interestingly, diabetic patients being treated with metformin, which increases sensitivity to insulin as opposed to other medications, are associated with a decreased risk of developing Alzheimer's. This suggests that the brain's ability to metabolize glucose is linked to the pathophysiology of Alzheimer's disease. A treatment of Alzheimer's disease with intranasal insulin spray is promising because it delivers a flood of insulin to the central nervous system without affecting blood insulin levels. In studies conducted on mice, insulin administered through the nose binds to receptors in the hippocampus and frontal cortex within 60 minutes. In humans, 3-week-long treatments with insulin spray in patients with Alzheimer's disease has been shown to improve central nervous system insulin levels and improve delayed story recall and cognition. While we still need to learn a lot about Alzheimer's disease and intranasal insulin spray, I think it's a very promising path for us to continue searching down.
Now joining us is Dr. Ali from Detroit, Michigan.
Preliminary research may suggest that when insulin is taken as a nose spray, it reaches the brain within minutes and improves memory. However, one of the challenges with providing insulin this way is it could easily disrupt your blood sugar levels. If someone's blood sugar drops too low, it creates many complications such as confusion, heart palpitations, anxiety, and visual disturbances. Secondly, intrainsulin doesn't work for everyone, but it's not clear why. Some evidence suggests that genetics may play a role. For example, a small 2008 study in the Journal of Alzheimer's Disease found that intranasal insulin increased blood levels of A-beta-42, the toxin implicated in the development of late-onset Alzheimer's disease. This may indicate that the insulin was working by removing the protein from the brain and having it removed by the bloodstream, but other reasons are possible.
Now joining us from California is Morgan, our lead reporter, while she is questioning the public on their views on this important issue.
Thanks, Sam. Reporting live from Hollywood, California, this is Morgan Freeman, and I'm with Shaquille O'Neal. Shaquille, what do you think are the long-term effects of Alzheimer's disease?
Well, I think you start to forget a lot of stuff, like your wife's name, your kids, and I know after a while it can be pretty lethal. I don't know, though.
Now, what do you think are the long-term effects of type 2 diabetes?
Well, you gotta know what your sugar level is, right? Then you gotta be like, oh, I'm gonna prick myself and find out how much glucose, sucrose, something like that is in your blood, and then you gotta check that, right? Otherwise it's too high or too low sometimes.
Would you be surprised if I told you that the two were related?
Yes, definitely.
Are you aware of the insulin nasal spray as a potential treatment for Alzheimer's disease?
No, I'm not.
Well, there is now evidence that demonstrates that insulin and its receptors in the brain act as key elements to memory formation and learning beyond its function for glucose uptake. So, now you can take that back to New Haven, Connecticut.
I can. I'll give it to my grandpap.
Okay, so, did you know that?
I did not.
Alright, well thanks, Shaquille. Reporting live from Hollywood, California, this is Morgan Freeman.
Thank you, Morgan, for providing our viewers with the public's opinion of this important advance in medicine. According to the experts at Mayo Clinic hospitals, no physicians are currently prescribing insulin at this time. However, the success of nasal insulin spray during initial experiments showed promising results. Additional experiments to test the safety and efficacy of this treatment are taking place, hopefully leading to a successful treatment for this debilitating disease. In this study of patients with Alzheimer's, the patients with the added comorbidity of diabetes suffered lower survival rates post-diagnosis than patients unaffected by diabetes. It seems plausible that the insulin resistance in diabetes patients may be negatively affecting their health and speeding up the cognitive decline caused by Alzheimer's. Thank you for joining us here at Channel 4 News. Please tune in later for more important health updates.
It's like, I guess you're gonna die.
What do you think are the long-term effects of Alzheimer's disease?
Long-term effects, I think.